going to share my screen. And I think we are going to get started in just a second. Okay.
Oh, we're going on Facebook?
We are live on Facebook. So that is right. Okay. We are now live. Thank you everyone for joining our December webinar on an incredibly important topic that is what we've called the second pandemic, really the effects of COVID-19 on mental health. Mental health is something that impacts every single person, every single one of us, and oftentimes isn't discussed openly. There are a lot of taboos and stigmas around addressing mental health, and it's an incredibly important time to be talking about these, the impact of mental health on our lives and how we can manage it. And so we've been honored to invite 3 attendees to join us to speak about it, because anyone that's joining us for the first time, the mission of CoVelocity is to work with healthcare technologists to deliver life-saving solutions to individuals and communities everywhere. And so we work with a number of different technology companies and innovators that can help address different challenges in healthcare delivery. And I'm honored to invite today to our panel 3 really amazing people that have done very, very important work in the area of mental and behavioral health. We're going to be hearing today from first Dr. Martha Ireland, who is the co-founder and CEO of VT Connect, or Virtual Therapy Connect. It's a secure, simple, and affordable telehealth solution. She's an entrepreneur, a nurse, a psychotherapist. So she'll be giving us a bit of her clinical background as well. And she has a wealth of expertise within the US healthcare system, as well as having worked in different countries across Africa. So she has about 30 years of experience in medical and behavioral health, and will be shedding some light on this second pandemic. Next, we'll be hearing from Swati Surf, the founder and CEO of Lightsprite. She's a leader who developed and launched this disruptive technology. It's been based off of games. Their commercialization products led to several patents, including Nike's first wearable technology patents. She has been named Innovator of the Year by a number of different organizations. I've had the pleasure of spending time with her as a part of the Women's Forum in Paris, and she has really done some very innovative work around addressing mental health in a way that you can do from home. And then lastly, we'll be hearing from Alon Joffe, who is the co-founder and CEO of Elios Health, which is a behavioral health toolkit that can run in the background of both online and offline counseling to quantify, analyze, and automatically report on salient points from sessions. He's a former investor in a number of startups, and he's done a lot of leadership work with the mental health first aid program that was used across the Israeli Air Force. So we have Martha and Swati are joining us from the United States. Alon's joining us from Israel. And just to give you a little bit of background for this 45-minute webinar, we'll be doing a little bit of an introduction to the topic. Then we'll be hearing from Dr. Martha, then Swati, then Alon. Then we'll have a panel discussion and plenty of time for questions and answers. So definitely keep your questions and answers and write them down at the bottom of the chat. There's a Q&A chat, or you can also wait, just raise your hand. There's a button to do that. And this is being live broadcasted and also being recorded. So if you miss anything, you'll be able to watch it later. So to discuss a little bit of background on this topic, we all know we've all been impacted by the pandemic of COVID-19, but the WHO actually put together a survey from 130 countries that found evidence of mental health of the pandemic, it really disrupting mental health services, both for counseling and psychotherapy, and also to emergency interventions. Um, we've seen a huge amount of disruption to access to medication and also to mental health services that are provided normally in schools or in the workplace, just through the nature of the lockdowns that we've seen during the pandemic. On top of this, when we're thinking about the impact of actually having COVID-19 on our own mental health, on anxiety, on depression, on psychiatric illness generally, there's been a huge difference when studying the impact of influenza on these different disorders versus COVID-19. And we're seeing quite a stark contrast here. And recognizing that there has been a real impact on our mental health. And this leads to many questions of how do we address that? Or are we doing enough to address it? And how long will it last? And specifically, when thinking about COVID-19 survivors, there have been a number of studies conducted. This is a recent one that was published in October. That's showing that, first of all, females are suffering more than males, which is not uncommon in a lot of different aspects of healthcare, but also that it's really having a long-term impact on things like causing PTSD, depression, anxiety. So it's not just an illness that is lasting a few weeks, but it's really having an impact that could last years or a lifetime if we don't do something about it. So I wanted to highlight just one example from the United States where we're looking at the difference in mental well-being between 2019 and 2020. And you can see that amongst every group of the population, there has been a drop in the way that people rate their mental health. And I think this is just reflective of really what we're seeing in the world, especially if you take this into account together with what we saw from the WHO survey. And so hopefully we'll hear about both the impact that this is having, not just in statistics, but on lives from our panel, and also what are some ways that we can address this. So I'd like to begin by welcoming Dr. Martha.
Thank you, Yael. And I so appreciate being invited to be here today and to share. And thank you for all that background information and the studies that have been done. First, I'd like to share a little bit about VT Connect, and then I'll share how I got into healthcare and technology, and then take a look at the effects that COVID-19 has had on all of us. First, VT Connect is a secure cross-platform video teleconferencing solution developed uniquely for the behavioral health field. It's tailored to meet the needs of the practitioners and the client. We have included things like group capabilities, a robust administrative portal with many services such as organizational management, white labeling, secure emailing, data collection, and other services. I personally have been involved in technology and healthcare my whole career. First, I started out as an ICU nurse, where we have a lot of technology to monitor how the physical body is doing, and particularly using telemetry to monitor patients that were not in the ICU. So when I moved into the behavioral health field, it was it was a very good fit and natural for me to consider how could I see my clients in a secure virtual way that would allow increased compliance for attending sessions by the client, allow continuity care, and ultimately a better successful outcome for the client. So that was the beginning of developing the VT Connect solution, so that there was a professional platform for clinicians to use, and particularly in the United States, where we need to meet particularly secure requirements through HIPAA and high-tech regulations. Little did I know, though, when developing VT Connect, that COVID-19 would change the landscape for everyone receiving and providing mental health services. I'd like to look at the next part is the trauma that has been created by COVID-19. And in order for there to be trauma, there's a predator and there's a victim. COVID-19 is the predator, and we have been the victim. Dr. Basil van der Kerk, who's a renowned psychiatrist in the field of trauma, defines trauma as an experience that basically leaves people stuck in a state of helplessness and terror. We are dealing with personal trauma and societal trauma at this time. We have three responses available to us with trauma. The first is to fight. Well, COVID-19, we couldn't fight. We didn't know what it was. And we couldn't run or flee because if we went outside, there's a very good possibility that the predator of COVID-19 would affect us. So the next response was become emotionally frozen, basically frozen in time. So let's take a look at the stages of trauma that people have felt. First is the acute trauma, which was the initial insult when we found out about COVID-19 and the pandemic, and that we had to shelter in place, which happened in February or March of 2020. And there still was the hope that it would not last very long. When that did not happen, we moved into a more chronic trauma state with prolonged exposure to the stressful event of COVID-19. And again, remind you, we are frozen. We cannot fight and we cannot flee. And it is being held within our bodies and affecting our mental health. Eventually, we've moved into more complex trauma, which results from the exposure to multiple traumatic events. This includes loss of control, loss of choices in our life, and fears of unknown, along with the reality of lost income, lost jobs, food insecurity, illness, and death of loved ones. Of course, we do see some hope on the horizon with immunizations, but I think we will be dealing with complex trauma for a long period, even though COVID-19 will be in the rearview mirror at some point. Some of the mental health symptoms that we're seeing and that I've seen in my own private practice include increased depression, anxiety, suicidal ideation, addiction, self-harm, abuse, and a variety of other things. Technology tools are helping clients with mental health trauma issues to connect with their practitioners so they can work on deactivating, processing, and metabolizing their traumatic responses by learning stress reduction skills and gaining new insights and possibly even receiving some medication. The technology connection tools help to mitigate some of their trauma responses, including a sense of helplessness and loneliness. I am aware, though, that in the statistics that Yale shared, that unfortunately it's not an even balance worldwide in being able to access the resources, but hopefully that will begin to change. The other thing that's very important to me is technology and balance. And I also want to normalize that even though we may be seeing a lot of difficult and disabling psychopathology, that not everyone will succumb to that they've had some inner strength or maybe limited help with some tools via technology to find new strengths and insights and wisdom. However, I do want to say it's important that we move into evidence-based use of technology. It's paramount as we move forward with integrating technology into the behavioral health field. We need to know the efficacy of the telehealth delivery services, because if it does not work and does not improve the mental health services and status for the client, then it has no value, even though a developer thinks it might be the greatest widget ever designed. So I just asking you to be mindful as you're selecting your telehealth tools within your practice or organization. Technology is a blessing that's helped to provide services and tools to those with the mental health issues. However, I also think it's important that we are stewards of balance. As an ICU nurse, the goal is to stabilize the physical body so that it did not need all the technological tools to support it, that the person moved into recovery and was able to leave the ICU. I believe the same is true for behavioral health. The behavioral health technology tools are available for identification, intervention, treatment, then stabilization towards recovery that eventually decreases the dependency on the technology. Integrity must be a part of the development and use of delivery of technology, or imbalance and illness may pursue creating new mental health issues. It's my belief that healthy connections with our bodies, which I think is the best technological tool ever designed, and our connection to each other and humanity is ultimately the best indicator for medicine for one's own mental and physical well-being. I really appreciate the time to share with you today, and I send it back to Yael to move on with the seminar or webinar.
Thank you so much, Martha. That was really, I think, very insightful and very helpful. Also understanding it from the perspective of someone who's worked as a clinician within this incredibly important field. Our next speaker is going to be Swati Surf, and who is the co-founder and CEO of Lightsprite, and I think has something really unique to share. Swati, would you like to please take it away?
Sure. Thank you, Yael and Ariel. We're very excited to be here. I am going to share my screen, and please let me know when it is showing.
Looks great.
Can everybody see it?
Mhm.
Okay, awesome. So we are very excited to share our work with you today. We know video games captivate, but can they go one step further and improve health? I'm Swati, founder and CEO of Lightsprite, and we build games to help people manage chronic health conditions. Clinicians and players rely on our data insights. Our clinically validated mental health video game, Cinesprite, is the first to win a US Surgeon General Award and the only one recommended by insurance companies and clinicians today. There's a lot of stigma associated with mental health, as Martha and as Yael has mentioned already. And it doesn't have to be that way. Oops, sorry, hold on. Games are fun. They're immersive, they're familiar, and they're approachable by people of all ages. They focus attention, inspire, and empower people to learn skills on a long-term basis. They also create community. So games get people engaged, and then engaged people get better faster. So who are the gamers today? And just taking a look at the US as a representative, according to the Electronic Software Association and the American Association of Retired People, in the US, the gamers today are 35 to 44 years old. 45% identify as females, and 64% of all Americans play video games regularly. And 45% of the adults over 50 play regularly, and a majority of them play at least once a week. And why do they play? They play for mental stimulation, stay connected with loved ones, and to relax and de-stress. And with the pandemic, new gamers have come online by the millions. Video game sales worldwide have increased 23% over the same period last year. Now, on the clinical side, clinicians use our unique patient-generated data to transform care delivery. We passively collect this information and create meaningful interventions. And this is even more important with COVID-19 as care starts to move into more of a remote setting. Cinesprite, oops, am I still sharing? Something weird happened.
Okay. You are still sharing.
Okay, I don't know what happened there. Okay, sorry. Cinesprite has the optional involvement of a clinician. Oh, sorry, yeah. And in a clinical setting, there we go. And in a clinical setting, we have worked with a range of diagnoses, including anxiety, depression, and substance abuse. They love the ability to customize care and create equitable solutions tailored to each patient. Clinicians can review important data, tell how treatment is progressing, develop customized strategies, and they can see their patients achieve lower assessment scores more quickly. Our foundation includes our clinical results, and it's the reason why we've won over 25 Global Health Innovation Awards. Our clinical improvement on an industry standard scale of the PHQ-8 translates into a person being more active 2 more days each week. And when used as an adjunct to alongside therapy, it has the same scale improvement as a pharmacologic. Our independent health economic study is the necessary ROI evidence to encourage high provider adoption. Our clinical results have translated into a 17 quality gain per 1,000 patients. A primary care clinic with 2,000 patients in the US can realize an additional $50,000 in revenue annually via BHI codes. But clinical results don't matter if people don't use it. And we have built a technology that solves mental health issues and people love. We have retention rates 3x above the industry average, an NPS of 88, and 94% of our players would recommend or strongly recommend Cinnesprite. With the pandemic, we have seen a robust organic consumer demand. We have helped individuals, frontline providers with their anxiety, depression, and impacts of isolation. And as you can see here, we are a trusted support tool for the people at their most vulnerable points in their lives. Cinnesprite appeals to a broad age range, which means it's really great for families. Our core user is a woman, it fits the demographic of a typical caregiver, a woman in her 40s. Cinnesprite itself is designed as a first-line micro-intervention. It is based on Bandura's social cognitive theory, a commonly accepted framework by clinicians. As a player-driven world exploration game, it is a safe place where a person can explore their emotions, understand their triggers, discover what evidence-based techniques work for them, and learn those skills. Darren is a typical Cinnesprite player. He has been looking for ways to manage his stress at home and at work. A few times a week, he opens up Cinnesprite and takes a few minutes to reflect with Socks, the main game character. Socks becomes a Zen master by teaching Darren techniques that are proven to reduce depression, anxiety, and isolation. Socks is a digital companion on Darren's healing journey and provides critical emotional support. Darren picks from a range of mini games. Socks guides Darren through journaling and questions that explore his emotion, meditation and exercise that especially helps Darren to refocus and reset so he can tackle his obstacles, and breathing. The world expands as Darren learns these skills, and he discovers which techniques work for him. He feels supported and can face his daily challenges no matter what they are. He feels more grounded and present, and he makes meaningful connections with loved ones. He feels less lonely, and in 6 weeks, Darren shows clinical improvements with his symptoms. Soon we'll be releasing updates to 2 of our mini games, the AR Butterfly Walk that encourages physical activity, and our multiplayer gratitude game, which is especially useful for families who are unable to physically visit a loved one or need to monitor them regularly. Games get people of all ages engaged. Engaged people get better faster. Thank you.
Thank you so much, Swati. I think what you're doing is something really unique and is really addressing many of the challenges that we're experiencing right now, especially with being unable to go and access care very easily and maybe looking for something to do at home. So thank you for sharing that. And I think before we go into questions and answers, which we're already starting to get a number of, so I'm quite excited about that. Alon, will you please present yourself, give us your thoughts, and share a little bit about yourself?
Of course, and thank you so much for inviting me and giving us the opportunity to share a little bit of the work that we do. So like Yael said, my name is Alon Jaffem, and I'm one of the co-founders and the CEO with Elias Health. And I think that it really kind of align with both with what Martha and Swati said regarding, where we are now in addressing this behavioral health pandemic. So we see it, or sometimes call it, kind of the silent pandemic that we're seeing that underlies what's going on now with COVID. And we talked about this widespread distress and the unemployment rates that are through the roof. But this is also a huge driver for cost for a lot of organization. And at the end of the day, what we are seeing is an exponential increase in demand for behavioral health services. And that exponential increase in demand, that can happen through telehealth mostly now, and Martha is probably seeing that very closely. But that demand can also come in the form of, what can we do at home? And I'm sure Swati see that as well. And also just face-to-face therapy that is still happening and now continuing to come back into norm. And so that exponential increase in demand is meeting a declining number of clinicians. And we are expecting a shortage of between 200 and 250,000 clinicians in a few years. And that gap puts a lot of administrative burden on clinicians that are now being expected to see more clients because of what's going on now with COVID, and also show outcomes and show that their clients are improving because of this huge duress in our society. And so what Elios Health is all about is really how can we empower clinicians? How can we empower their workflow and enable them to do what they like and what they do best, which is caring for their clients, providing care, and provide healing to the society. And so Elios is really kind of a complete care intelligence solution that empowers clinicians' workflow. And when we think about the workflow, then we always like to think from the session, right? So it starts with a session, and that session can happen via VT Connect, via telehealth, it can happen via face-to-face. And then what Elios is doing is capture this session, whether it's on an individual or a group level, whether it's through remote supervision, and provides two unique value proposition to the clinician to really help them. One is on the clinical side, really understanding, what are the best practices? What's working for my population? What's working for my clients? Which type of techniques or intervention am I using? Am I following evidence-based protocols and guidelines? On the administrative side of things, we know clinicians today roughly spend a day a week just writing progress notes. That's roughly 15 minutes that it will take a clinician to write a note on a 45-minute session. And so what we do is we create the baseline for those reports, for those progress reports. We cut the time spent on those progress notes by half. We collect outcomes from the consumers, from the clients directly, like PHQ-9, like GUIDE-7, and then create additional reports, also around HEDIS measures, which is also a very, very kind of unique and important topic. Integrate that with their EMR, and at the end of the day, provide visibility to the organization on who's improving, who's not improving, who needs more support, who is doing evidence-based practice, really trying to answer the question of what's working for who, delivering personalized evidence-based care at scale, and addressing the growing need that COVID has unfortunately brought us in helping and providing care to our members and to our clients. Elios has really brought unique natural language processing technologies into behavioral health and voice analysis into behavioral health. Our technology is based on analyzing tens of thousands of sessions and really learns how to surface those actionable insights for the clinician, while also aggregate that clinical information and provide actionable administrative value that allow clinician to, again, focus on what they do best, and it's definitely caring for their clients. This is an example of case study with one of the providers that we work with. We're seeing a reduction from almost 13 minutes spent to around 7 minutes spent on writing a progress note for their clinician. And one additional interesting thing that we are now doing, very related to COVID-19, is understanding the psychopathology that COVID has brought us, and really trying to understand how can we tweak? How can we customize the type of interventions, the type of evidence-based practices that we deliver to our members based on this very unique COVID-related stress? And so what we do is we measure between session assessments for it is an evidence-based scale called that is called weekly fear of illness and virus evaluation. We collect that from the members between sessions. We see we see the content, we see what is the type of interventions that were delivered. And once we have the two sides, we can really understand the correlation. We can really start to understand what's working for who. Is those type of interventions really impacting and lowering the stress that is related to COVID? And so that's a glimpse into the work that we do now with an inpatient behavioral health facility. And with that, I'll maybe leave some time for questions and answers. So thank you so much again for having us and allowing us to present. Thank you.
Thank you, Alon. Thank you so much. And that was a very helpful introduction. Also, I think you touched on some issues that we don't necessarily think about when it comes to mental and behavioral health, which is sort of the administrative side of things. And that's an incredibly important part of being able to actually scale access to behavioral health. So I actually think that we've received quite a few questions already. So let's jump straight into Q&A. And then if there's time, I'll also ask some of my other questions that I have prepared. Let's begin by this question from Emily. Thank you, Emily. You've asked, can we talk a bit about the business models for each of these solutions? Do you market to individual providers, hospital systems, governments, consumers, and which countries do you operate in? And just to kind of frame that question, I've also received a number of inquiries about partnerships in different countries. I know that our attendees are coming from all parts of the world. We've got Burundi, India, the US, everywhere. So this is a global issue. So kind of keeping that in mind, how can you talk about your business models, who you're marketing to, and where? Martha, would you like to start?
Me start? Okay, I do
Yes,
know.
please. We'll do Martha, Swati, and Alon, please.
Okay. Currently, our product is available within the United States, and we market to individual practitioners, to groups, to hospital systems. It is a platform that the organizations can use for their clinicians and their patients. We are looking at expanding more globally in the near future, and it is a monthly subscription. There is not, you're not required to sign on for a year. The cost is to the practitioner or to the institution, not to the client. The client's fees or charges come strictly with however the clinician or the organization is charging that client, whether they're using insurance or self-pay. And that is our format at this time. We do have it is an app that is utilized for the secure video teleconferencing between the practitioner and the client. And as I said, I hope, and we are working on collaboration with other companies to increase the offerings and the wealth of services through VT Connect, which is also expanding the horizons beyond the US.
Thank you, Martha. Swati, we're having more and more questions about Lightsprite. Where can it be used? How does your business model work?
Sure. So our business model is enterprise. So we work directly. We work as our main customers are insurance companies and health systems. It also then as a payer, it also includes governments. What has happened is with COVID, we saw a robust consumer and employer demand. So we launched we had our beta available globally. So we have been available globally since 2013. And then just most recently, as I mentioned, with COVID, we launched a new direct-to-consumer subscription, as it allows us to further monetize, but also demonstrate to enterprise customers like health systems, providers, as well as the governments, that we have wide appeal at scale. So if anybody is interested, feel free to contact me. I can put my email in the chat, and we'd love to talk to you and see how we can help support your patients, because we can actually span the care continuum. It can be used as a self-help tool, or it can be integrated into care settings, into care plans with our dashboard. So please feel free to contact us.
And Swati, I was going to say that I actually a couple of weeks ago downloaded Lightsprite as well. I absolutely love it, and I was going to suggest maybe this is why I invited you on. This is brilliant. I was going to suggest if you want to put the links so that people can download on their own app store and try it out for themselves, that would be very helpful.
Yeah, that I would strongly recommend anybody, if you want to know what it's really like and see for yourself. And what's interesting is we just launched, we launched it in October, the new version. So the beta had all the modules, so it would allow us to test and understand, and also collect our clinical evidence, but also understand what players liked and what they didn't like. And with the new version, the direct-to-consumer, right now, only 2 of the previous modules are released, and we'll be releasing, as I mentioned, the Gratitude mini game, which is a multiplayer game, and the AR Butterfly Walk in the upcoming months here. We ran our first ever set of ads to direct people, and just to underscore the importance of this, and all of you on the call know this already, but it's so popular that even during this period where ads are very expensive, our ad rates and our click-through rates are basically resulting in our ad costs being 1/10 of what a normal ad install is going to be. So that just shows the demand. We're seeing a lot of likes, a lot of shares. I believe we're getting at least a good portion of, and I think that's partially because we're getting a good portion of people, providers and therapists, referring people through word of mouth. Potentially it's either through their own friends and family or providers, because we have an ad set that is also targeting therapists and providers as well. So a lot of demand, and it seems like this is the modality that people are resonating with.
Excellent. Alon.
There was one question in the chat about children. Our focus is, this is for an adult population. We've had players as young as 3 years old, and when we've tested it with kids, it's done really well. They love to meditate with socks. But the core audience was intended when we designed it, and continues to be an adult population.
Thank you, Swati. Although that is a very good question to think about, sort of the focus on children. And Alon, I think at some point you and I discussed thinking about the impact of COVID-19 on children. So maybe you can address both questions, both children, and also talk about your business model, where you're available, how you work.
Yeah, definitely. So our AI platform works across care settings, across care techniques. So whether it's individuals, whether it's group, whether it's face-to-face, telehealth, we're kind of agnostic to that, and you will get the same value. I think the ROI model here is very clear. Only from kind of an efficiency perspective, only if we look at that limited scope, then, like I said, we cut the administrative time by half. So that's 3 to 4 hours that are now freed up for clinicians. And let's say even they do 1 hour where they see one more clinician and one more client and improve access to care, that's additional revenue that they can generate. And in 30 days, actually in 7 days, they have a very clear ROI model for using Elios. In terms of our business model, we're working mainly with provider organizations, large health systems, and payers. I would say less so with the individual clinician, but definitely open to that. And I also shared my email here via the chat, so feel free to reach out. And again, we are kind of agnostic to the technology stack that you use. You don't need to change your EHR. You don't need to change your telehealth platform. We can play along nicely with everyone. So that's kind of how we operate, and our business model. Elios Health works excellent through, across geographies and location. The only caveat here is that we work only with English right now. So if the treatment is being delivered in English, you will see the value from Elios.
Thank you, Alon. I'm realizing we only have a few minutes. It's been such an interesting conversation, and you all have so much depth to your knowledge. So I want to open up some room for questions here. Does anybody want to ask a question? I've got another one from Emily. Oh, there you go. What languages does Elios have available at the moment? Yes, you saw it is just English.
And we're working on Spanish as well.
Excellent. Anyone else that's joined us for the panel, would you like to ask a question? If not, I've got a few. All right. I'm going to ask you guys just really tips for health systems, for individuals on how to manage their mental well-being in this time. And let's go Alon, Swati, and Martha.
Okay.
It was cut off. The question was around tips for managing the mental health.
Yeah, any tips for both health systems and individuals for managing your mental health?
I think that, first and foremost, there are two main problems in mental health that everyone here on this panel is trying to address, whether it's access to care or quality of care, right? And I think that these are the two verticals that should lead health systems in their decisions, and how they think about solving this national crisis, this global crisis that we're in. And really, I think in today's world where telehealth has come to the forefront, there is greater and better access to care. The pricing and the reimbursement models are very much the same. I think the next differentiator and what we should focus on is quality of care, and how can we provide evidence-based practice that works for everyone and that is measurable, and that we can see the progress. So that's kind of my 2 cents on that topic.
Thank you. Swati, would you like to add anything to that?
Could you repeat the question again?
Yes. What are some tips that you have both for health systems and for individuals on managing our mental well-being?
I think for health systems, I think it's important to understand where patients are at and meeting them as best as you can. I know, especially for health systems, care has moved remotely, and that's making it a challenge. But especially with mental health, it's really important to understand where the patient is at emotionally, physically, as well as financially, and what can they absorb. Because if they're looking for treatment, it's only going to be as effective as a solution is only going to be effective if it's implemented or it's something they can follow or work. And that's a challenge with a lot of behavioral health or mental health solutions, is that it's really difficult for patients to integrate it into their lives. And so even, for example, with teletherapy, if there's a bunch of people now sequestered in a small enclosed environment, it's really hard to do a virtual therapy session when you've got, somebody in the next room, right? I mean, even though it's more convenient, but what's the context that it's being delivered on the patient side? So I think you have to really be thoughtful about that. And find, are there ways to allow for privacy, places, because I know places are opening up and then we're shutting down, and at least in the US it's a mess as far as any kind of pandemic response. So it's going to be really important to understand from the end user, what are they experiencing, right? And then for all of us, and I've said this to my team, I made it pretty clear, you need to make the space to take care of yourself, whatever it is. And sometimes self-care means you have to run your errands in the middle of the day, or you have to go for your walk. Like for us, I'm in Seattle. It gets dark at 4. I'm not as bad as like some of my colleagues or people we've talked to in Sweden, where it gets dark at 2:30, but I'm not walking out in the middle of the dark, right, for my exercise. So I have to go in the middle of the day. So getting that flexibility to allow integration for yourself is really important. And then setting those boundaries. And that's what I told my team. I said, look, you gotta make the time, whatever it is, and make sure you're spending time with your friends, your family, you're taking care of yourself right now, because we're having to do things differently. So.
Excellent. Thank you. Thank you, Swati. So I think so far, I mean, really thinking about what you guys have said, the quality of care, meeting our patients where they're at, physically, emotionally, and financially, and making space to take care of ourselves. Martha, I'd love to hear your thoughts on that. And I'm also going to add one more thing to it, is that clinicians are people too. And I'd love to know what you have for tips for health systems, individuals, and clinicians.
I support a lot of what Swati just shared, and a lot of it is about balance, and that we do, both clinicians and the patients need to find out, create balance within their life, find stress reducers that work for them. I'm not sure one size fits all. And that's why I love technology, in the sense of the creativity and the different tools that are available. With Elios, it's helping to cut down time on the clinician's work so that they can maybe take some of that extra time to take care of themselves. And Swati's really fun way to learn stress reducing types of skills. But I do, again, both the clinicians, which I don't think they've been given enough focus, and as a clinician, we're exhausted. We are totally exhausted with the amount of screen time and the direct video teleconferencing and the direct eye contact throughout the whole session. Again, having to get creative. Do they take the iPhone with the app out to the car so they can have some privacy? Where can they find that? Then is it a nice enough day that they can go out to the park and use their mobile device? So there's that whole creative piece. Again, as a clinician, it's about also mentoring and being a steward. And as Swati did with her team, and telling our clients and ourselves that be sure you take that time off, walk away from the screen, go for that walk, be with nature, connect with a friend. Because as a clinician, if we don't take care of ourselves during this time where we are constantly waking up to trauma with COVID-19 that still exists, even though we have the immunization, that will take time for it to, have the positive effects of dealing with this predator and trauma, to be able to step away and soothe yourself through meditation. And of course, for me, it's also really look at your diet. Make sure you're doing regulated eating, that you're selecting foods that are nurturing, and then include other nurturing behaviors. So again, I'm so grateful to be part of this team and to work with the integration of the various really wonderful technological tools that are there to help us with balance and maintain mental health, both as a practitioner and as a client.
Thank you. Thank you so much, Martha. I think you summed that up perfectly. I see we are completely out of time. So I want to thank all three of you for joining us on this panel, and everyone that attended and that watched it live on Facebook as well. And I'll be sending a recording of this as well as the PowerPoint. So thank you all very, very much.
Thank you so much.
Thank you.
Thank you.
Thank you. Everyone be safe and healthy and well.
Bye.
Thank you.